So up is up and down is down. So if any of you will have the misfortune of watching me help you this afternoon, I will look like a complete klutz because this is not what I'm used to, okay? So I'm just getting the excuses in now. So know your equipment, and there's a lot of equipment in endourology. I mean, I'm a total tech geek, and that's one of the reasons I like endourology, because there's lots of toys, okay? So scopes, baskets, lasers, get to know their capabilities, their limitations, what you can and can't do with them, ever so important, okay? And in terms of equipment, you know, what do you need as a minimum? Well, you need a scope, obviously. Reusable versus disposable. We run a hybrid system, so we've got both. You need to know how they deflect, where the laser fiber pokes out of, all that kind of stuff, okay? You need to know about your wires, and you know, I have a workhorse wire, which is a sensor wire, and then I have special wires like Terumo, zip wires, all these things, okay? And they've all got their purposes, which you'll learn. Ureteric catheters, straight and angled. Angled are really good for getting into tricky UOs. Access sheaths, standard sheaths. I think Ananda will talk a little bit about suction, so I'm not going to steal his thunder too much. Lasers, again, I'm sure are you going to cover this a bit?
I will touch a bit, yeah.
So, you know, what kind of laser, holmium, thulium, what does it do? Baskets, you don't need loads of baskets, okay? I've got two. I've got a zero tip basket and I've got an N-gauge basket. Those are the only two baskets you need. So, you know, one of the first things I did as a consultant 16 years ago is my predecessor accumulated about 11 different types. I just stop ordering all of those. Total waste of time, total waste of money. Actually, some of them were quite dangerous, like the Leslie parachute, deadly basket, never use that. You need a zero tip, you need an N-gauge, you don't need any other baskets, okay? Stents, how to use them, when to put them in. These are the things you need, you don't need anything else, okay? And then finally, know your limits, okay? So we're going to look at a bit of maths in a minute about stones. Know how big your sheath is, means what size of fragment you can pull out. And bear in mind operative time, really important. I never, and I really do mean this, I never operate for more than 90 minutes because the risk of sepsis exponentially increases. You can live again, fight another day, come back. You know, don't go in for heroic 2.5 hour clearance. If you're doing a ureteroscopy for 2.5 hours, you probably ought to have done a perk, okay? It's a wrong operation. Bit of maths.
Can I ask another question?
Yeah.
So how do you navigate that with like tricky patient that's not fit for anesthetic?
Come back and do it in numerous sittings, always safer.